Good morning. Thank you for joining us today for the Nursing Seminar Series brought to you by Providence Nursing Institute. My name is Michelle Woodley, and I'm the Chief Nursing Informatics Officer for Providence St. Joseph Health, and I'll be your host for today's event. The Nursing Seminar Series is a monthly event honoring the World Health Organization's 2020 Year of the Nurse and Midwife. Through a variety of presentations and topics, this informational series will focus on celebrating and recognizing the incredible work of our over 40,000 plus nurses across Providence. You see a sample of those here listed. Before we get started on today's topic of all the places of nursing, I'd like to tell you a few important points. This session is being brought to you via the Microsoft Teams live platform and is being recorded. All attendees will be automatically muted on the call, and there's a chat box on the right side of the page where you can type in questions throughout the session. Since our time today is limited, we will be posting the answers to all those questions on our SharePoint site following today's event. I also want to remind you that we have 1 hour of CNE credit available for this event. We have no conflicts of interest to disclose. And at the end of the session, the participants would be able to learn about key statistics regarding public trust in nursing and nursing around the world. You'll also be able to gain exposure to a sampling of unique nursing roles available at Providence St. Joseph Health. And finally, access the journey map with key milestones to consider on the road to a potential change in your nursing career. So today's presentation will focus on the great career of nursing and all its diversity. The Wordle you see depicted on the left represents all of the areas of nursing that are represented across Providence St. Joseph Health. The pictures that you'll see throughout this presentation are just representative of this diversity. Whether you're an educator or a clinical informaticist, whether you're practicing in a hospital or out in the community, nurses practice their same art and science in caring and advocating for their patients. Nursing's a wonderful and a unique career and truly is at the heart of the mission at Providence St. Joseph Health. I wanted to go ahead and just review with you briefly today's agenda. So we'll begin with a great reflection by Ann Kirby, who's our Executive Director of Care Management in Oregon. She'll begin our celebration on the variety and flexibility of the careers that nurses have here at Providence and talk about the huge impact we can have on health and well-being locally and around the world. Again, we'll hear from 3 colleagues on 3 unique roles that provide just a sampling of all the different facets of nursing. They'll share their story and the passion for their current role, and I'll introduce each of them individually before they speak. Lastly, the session will culminate with a journey map by Rachel Manchester, our Director of Nursing Quality Home and Community Care in Washington State. Rachel will provide practical next steps for nurses considering career advancement of a change within the great and vast career of nursing. I also want to take this opportunity to thank both Ann and Rachel, who joined me as the producers of today's event. So let's go ahead and get started with our reflection, and we welcome Ann Kirby.
Thank you, Michelle. Good morning, everyone. I'm going to start our reflection with a poem and follow that with some facts about nursing. So this is The Summer Day by Mary Oliver. Who made the world? Who made the swan and the black bear? Who made the grasshopper? This grasshopper, I mean, the one who has flung herself out of the grass, the one who is eating sugar out of my hand, who is moving her jaws back and forth instead of up and down, who is gazing around with her enormous and complicated eyes. Now she lifts her pale forearms and thoroughly washes her face. Now she snaps her wings open and floats away. I don't know exactly what a prayer is. I do know how to pay attention, how to fall down into the grass, how to kneel down in the grass, how to be idle and blessed, how to stroll through the fields, which is what I have been doing all day. Tell me, what else should I have done? Doesn't everything die at last and too soon? Tell me, what is it you plan to do with your one wild and precious life? And now that Mary Oliver has asked us to consider how we want to spend our one wild and precious life, let's consider one aspect of that life, our work as nurses. On this slide, you can see facts about the public perception of nursing. For the 18th year in a row, nurses are the most trusted profession, according to Gallup. For this poll, Gallup collects data via phone interviews on a random sample of over 1,000 participants across the country. And the respondents are asked how they would rate the honesty and ethical standards of various professions. Nurses topped the list, with 85% of respondents saying nurses' honesty and ethics were high or very high. According to the group FlorenceHealth.com, at least 80% of Gallup poll respondents have rated nurses' honesty and ethics as either high or very high almost every year since this poll was introduced in 2003. The only time the number dropped below 80% was in 2004, when it fell to 79%. For comparison, the next closest profession is engineers, and they are rated at 66%, with our physician colleagues being rated at 65%. On the next slide are some facts about nursing from the World Health Organization. These come from a report called The State of the World's Nursing. As you can see here, nursing is the largest occupational group across the world, accounting for approximately 59% of the health professions. This is 27.9 million nurses in the global nursing workforce. Over 80% of the world's nurses are in countries that account for half of our population. And this last bullet is a direct quote from the report. No global health agenda can be realized without concerted and sustained efforts to maximize the contributions of the nursing workforce and their roles within interprofessional health teams. And the report goes on to say that the world needs to invest in nursing education, create at least 6 million new nursing jobs by 2030 to offset our projected shortages and the inequitable distribution of where nurses work, and also to strengthen nursing leadership. Next slide, please. We wanted to share this information with you to think about as we discuss all the places of nursing. Because nurses are held in such high esteem by the public, we can make a huge impact on well-being. And because nurses are critical to world health, we can explore many options in our careers in the United States and around the world, in direct patient care and in policy making, education, and leadership roles. Sometimes so many options can seem overwhelming. Today, we invite you to intentionally consider your career and next steps, whether you're a new nurse, in the middle of your work life, or about to retire. How do you want to leverage the opportunity of being a nurse in our world and live your one wild and precious life? Thank you. Back to you, Michelle.
Thanks so much, Anne, for a great reflection. Now let's hear from a few of our nurses who will share their story and a little about the nursing career that excites them. We welcome our first of three presenters, Lisa Delaquila. Lisa is an infection prevention nurse practicing in Providence Home and Community Care for Washington, California, Oregon, and Alaska. COVID-19 has been front and center. Lisa and her colleagues have played a critical role for all of us. And now Lisa will share her great nursing journey. Welcome, Lisa.
Thank you, Michelle. I can hardly believe it, but I've been a nurse now for 23 years, and over half of those have been spent in infection prevention and control in some capacity. And I just want to express my gratitude for the opportunity to share my journey with you today. Next slide, please. A seed was planted. My mother retired from the county health department after working there over 30 years, starting in the lab, working as a lab tech, and working her way up and finishing out her career as a disease intervention specialist. I credit her for sparking my interest in microbiology and communicable disease. When I was young, there were days when I was lucky enough to get to spend the day at work with my mom. I have very fond memories of these days, which include chatting it up with a sweet blind man who ran the snack shop in the lobby, and of course going out to lunch. My favorite memories were made in the lab though. My mom taught me how to streak Petri dishes and spin liquids in flasks using magnets. It wasn't real work, of course, but it was really fun to pretend. Sometimes she would stay after work a bit and spend some time with me at the microscope. I watched her prepare slides and gram stain them. She would always pick something really interesting looking like giardia or yeast, or scrape spirochetes from my gums and let me look at them, and quiz me on what I saw. And needless to say, my favorite was the dark field microscope. I thought that was the bee's knees when I was a kid. Next slide, please. So why nursing? Fast forward to high school, where I took an elective class called Instructional Intern. This is where I spent an entire period of each day having an absolute blast, working with profoundly developmentally delayed kids. I learned to feed, tube feed, and assist with activities of daily living. But the best thing of all was that I learned what it felt like to receive the kind of unconditional love these kids gave so generously. They made me realize I wanted to be a nurse. At this point, I thought microbiology and communicable disease were going to remain part of my pre-career schooling, and that's where it would stay. Next slide, please. I got started right after high school and graduated with my RN 1 month after turning 21. From there, I worked in long-term traumatic head injury, then dialysis, then a clinic on the Navy base. I learned that the military environment wasn't exactly my cup of tea. I remembered how much I loved working with the dementia patients, though, when I was doing my clinical rotations in nursing school. So I decided to apply at the nearby nursing home. I did have worries about losing my skills and being judged because there was a terrible stigma that came along with long-term care nursing at the time. I put my worries aside and I applied anyway. Next slide, please. That's where my long-term care adventure began. I learned so much at that nursing home. Forget losing skills, I gained a ton. I had this one physician in particular that would take me under his wing. And when we rounded every Tuesday together, he treated me like a medical intern and taught me all kinds of things and held me to a higher standard that I tried to live up to. He taught me so much. I'll never forget him. As I became more comfortable with my charge nurse role, I started to look to see what else I could do in this setting. I would ask my director of nursing for opportunities often, and she would happily oblige me. She was one of my best mentors in my entire career. I also wanted to make it my personal goal to change the way nurses perceived, especially new nurses, perceived long-term care. Next slide, please. We had nurses from the local community college that would come to do their geriatric clinical rotations in our facility. I remembered how scary it was when I was a student, and I didn't want them to feel the same way. I made another personal mission to be kind to them and provide them with learning opportunities and take them along with me when I was doing something I thought they would think was interesting. I discovered I loved teaching. And before you know it, the college instructor asked me to start giving presentations to the students about all the opportunities long-term care had to offer. Eventually, I ended up working at that community college. I worked a second job, nights, 3 times a week, teaching first and second quarter nursing students. And also during this time, went back to school to get my BSN. Next slide, please. One day at this nursing home, the staff development coordinator position became vacant. In long-term care, it's typical to couple the clinical instructor position with the infection control position and call it staff development. I always thought this was a really interesting coupling because, as you can see by these pictures here, the character sets of an educator and an infection preventionist can differ quite a bit, but it works. And I love teaching. I love the creativity it allowed, but this part of me that loves science found myself gravitating back towards the infection control part of the role. After 6 years working at this facility, I took a director of nursing position for a large long-term care company. It was supposed to be the next natural step in my career. Although this was a really challenging and exciting role, I missed my students, I missed my bugs, and I ended up being back in staff development. I was then recruited by another large long-term care company to fill a role of education and infection control consultant for 24 facilities across 3 states. Next slide, please. I felt like I was on my way to my forever home in my career. The company later added more positions, and I was able to drop the clinical educator role and focus specifically on the infection control role. And that's here where I obtained my board certification in antibiotic stewardship. And then after 5 wonderful years, the company sold out to another company and things just weren't changing for the better. Soon after the change in companies, a good friend of mine, who was the director of nursing at the first long-term care company I talked about, sent me an advertisement for a new position at Providence. Next slide, please. And this is where I landed. They were advertising for a first-time position. It was a brand new position for an infection preventionist role to specifically serve all of Providence home and community care. The role covers not only nursing homes and assisted livings, but includes home health, hospice, PACE, home infusion, and other service lines across multiple states. This sounded like an amazing opportunity, so of course I jumped on it. Fortunately, I was offered the position and I started November 11th of this year, right before the COVID pandemic erupted in the United States. What a time to start. It's been scary, it's been difficult, but I'm surrounded by amazing leaders and some of the most wonderful people I've had the opportunity to work with in my entire career. I feel so blessed to be part of this phenomenal team. Next slide, please. In conclusion, I found my home, my nursing niche. My journey has transitioned from one of exploration to one of growth, and I'm looking forward to all the future adventures it brings. Hopefully no more pandemics though. This one is good. Thank you.
Thanks so much, Lisa, for sharing your story and for sharing your skills and your passion with us every single day. I especially enjoyed the fact of how you highlighted your mentors that have helped you and then how you grow through your career and throughout your career to bring you to where your passion is now today. So thank you. Next, we'll hear from Kristen Logan, who's the Director for Providence Medical Group Care Management in the Oregon region. Kristen will represent and share insights from a few of her team members practicing in a unique group of nurses in the Proactive Outreach team. Welcome, Kristen.
Thank you. Good morning, everyone. I am thrilled to be here today on behalf of 2 amazing nurses that I have the privilege of working with, Lexi Osmus and Sarah Helmick. I will be sharing 3 things about their nursing journey today. First, their unique role as nurses providing intensive care management on the Proactive Outreach team, what brought them to this role, as well as what keeps them in the role. To start us off, the Commission of Care Management defines care management as the collaborative process that assesses, plans, implements, coordinates, monitors, and evaluates the options and services required to meet the patient's health and human services needs. It is characterized by advocacy and communication and resource management and promotes quality and cost-effective interventions and outcomes. The Proactive Outreach team with Providence Medical Group in the Oregon region does just that. It provides community-based, intensive, wraparound care management services to patients and their families with complex social, behavioral, and medical needs. This is a unique program, and Sarah states there is incredible value in meeting patients where they are, seeing them in their own environment outside of the clinic setting. As care managers, Sarah and Lexi work with patients that may be unhoused, experiencing severe mental illness or substance use, with minimal resources or support to navigate their health and wellness needs. The multidisciplinary team of RNs and social workers and community health workers uses trauma-informed approach that supports, advocates, and empowers patients to meet their health and wellness goals. Lexi believes the combination of RNs and social workers on the team is a great blend of disciplines that complement one another for the best outcomes for the patient and coordination with their providers. As care managers, they develop a patient-centered plan of care that follows them across the care continuum. Next slide, please. Neither nurse planned to go into care management when they left nursing school. However, their experiences in nursing, desire for continued personal and professional growth, and a little divine intervention led them to their current role as proactive outreach care managers. Their diverse background includes ER, neurotrauma, cardiology, telemetry, med-surg, skilled nursing, residential memory care, and infection control, just to name a few. Each experience added valuable tools to their ever-growing nursing tool belt. This diverse background and broad knowledge base, in addition to their enjoyment of ambulatory care, their collaborative nature, innovative spirit, and holistic approach make them incredibly effective in their roles as care managers. Their interest for joining the proactive outreach team included the ability to engage with patients long-term to achieve patient-centered goals. Lexi states it well that she was interested in serving vulnerable populations, but in a different capacity than the ED, with an opportunity to have time to address issues and connect with patients through their entire healthcare continuum. Additionally, they can use their training and skills in a unique way. Sarah shares she is able to still use her RN training, skills, and knowledge, but in a unique way that challenges her every day. They are able to problem solve with patients using non-traditional solutions for patients in crisis. An example of this may include a patient that is newly diagnosed with diabetes, taking insulin for the first time, yet living in a van with limited funds and no refrigeration or food. Lastly, they enjoy working in ambulatory care and collaborating with healthcare providers across the continuum of care on behalf of their patients. Next slide, please. There are many things that keep Lexi and Sarah with the proactive outreach team. Lexi states it is her passion to help others that keeps her in her role, and the nature of the work, which is ever changing, preventing them from feeling bored or stagnant. Some of the things in common they enjoy most about their job include the patients, the care management approach, the multidisciplinary team they work with, and the work environment. Supporting the patients and advocating for them to achieve their identified health and wellness goals are the main drivers that keep them in this role. Sarah states the work is impactful and she gets to see the differences it can make in the lives and health outcomes of patients. Sarah, Lexi, and the entire team believe it is a privilege to be able to engage patients and support them along their journey. The proactive outreach team care management approach is of great value to them as well, being patient-centered and holistic. As nurses, we are all strong advocates for our patients, and in care management, it truly is their primary role and responsibility, especially with populations that may not feel they have a voice or are unfamiliar with or unprepared to navigate the healthcare system. A strong team is also important to each of the nurses. Being a part of an innovative team that continues to learn, change, and grow is tremendously important to the work they do each day. They enjoy that their input is valued, and they have a collaborative and multidisciplinary team to work and problem solve with. The work they do is extremely autonomous and challenging, and no day looks the same. COVID has certainly forced the team to be nimble and creative in how they care for their patients, especially since the people they work with are in vulnerable situations and may experience severe complications if they were to contract COVID. Thank you for this opportunity to share the amazing work of these brilliant and dedicated nurses on the proactive outreach team, and my gratitude goes to Sarah and Lexi for trusting me and sharing their stories. Thank you.
That was great, Kristen. Thank you so much for sharing our community-based nurses and representing them there. I think it's truly remarkable when we talk about meeting our patients where they live. Bringing care to some of our most vulnerable and marginalized, really bringing life to our mission that we really care for the poor and the vulnerable. So thank you again. And now I'd like to introduce Holly Kalua. Holly is the Director of Clinical Documentation Integrity for Northern California, Southern California, Orange County, High Desert, and Texas. And this is, thank you for joining us, Holly, and I will turn it over to you.
Thank you, Michelle, for having me today. I'm really excited to be able to share my journey, and my wish for everyone today is to reignite your heart for nursing, to make sure you've got that why you're in nursing, why you're in the field you're in, and really connect with that to help protect you from burnout stuff. All right, so are you curious about the role of clinical documentation integrity? Most people don't know about that, and yes, I spelled it that way. Our role is sending out queries to physicians. I'll talk more about that later, but we'll go into the journey into the next slide. Thank you. So sometimes people feel in their career they have to choose, oh, I really like sales, so I've got to do that. Or I want to be a teacher, so I'm going to go to school and become a teacher. Or maybe I'm a researcher. And you don't have to make that decision. When you're a nurse, become a nurse, and all of that is available to you. So there's more than one way to have a fulfilling nursing career, and it can be fulfilling in all the directions. The nurse there's looking like, which way do I go? All three ways, it's going to be fantastic. So just move forward. And so a nursing path is not a formula that everyone has a different journey, and it's not necessarily easy, but every part of your journey is what has created you and the depth of your knowledge, your approach to your profession. And so I was like, what would be the right formula for that? Well, there isn't a right formula, but what I think it is a successful and meaningful nursing career is obstacles, but opportunities. And you have these forks in the road, and make sure to tap into those pivot strategies, and then you'll have that ultimate career journey. Thank you. Next slide. So I have been a nurse for 34 years. I can't believe, when I used to hear people say, I've been a nurse for 30 years, I thought, oh my goodness, they're not retired yet. No. So I went straight out of high school, a pioneer in my family. Graduating from college was a really lofty goal. So my parents were like, okay, we'll pay for your registration and books and you can do that college thing. And so I did, graduated with my AS in nursing, and started in skilled nursing facility. And actually, I'm in CDI now because of that very first job. The director of nursing left. I've been a nurse for 4 months, and they said, can you be the interim director? And I was like, oh my goodness, I barely learned how to pass meds on time, but I'll go for it. So I really want to encourage you that if someone sees something in you, believe that they are right and don't question whether you can do it or not. So they gave me a stack of charts that were denied. They weren't going to get paid for it. And they said, can you figure out what you can write or find what's in there so we can get paid? So I always had that in the back of my mind, that documentation tells that story and it helps the organization get paid. There wasn't CDI at that time. And so then, classic med-surg, ICU, OB is what I wanted to do since school. I had a teenage friend that got pregnant, and I just loved that I got to go in and help count to 10 and tell her to push, and I wanted to be an OB nurse. It was hard to get into, but I did, and I unfortunately got hurt, and I'll tell you a little bit more about that. That put me into case management, and then CDI and revenue integrity. I had a big fork in the road at that point, and because of that, I ended up at St. Joseph and Providence St. Joseph. Next slide. So in that revenue integrity position, I was over CDI and case management, and then our company outsourced to a different company to take over revenue cycle. And they gave us 13 days, or they gave me, it was kind of a staggered thing, but they gave me 13 days. Go find another job or you're going to be outsourced. And they added a whole nother job on top of what I was doing. So I was doing a job for each company. And that was a point I had to make a decision. Can I get a job in 13 days? I don't think so. So I'm gonna dive in and do it. I got to the orientation, realized I wasn't on the org chart of this new company. And it's a little disconcerting. And so someone said, yeah, I guess you better apply for another job then. So I went in for the interview, and I have this experience, and yes, I can do this and that. I said, but can I use that whiteboard to tell you what I'm currently doing? And so I went up to the whiteboard and drew what I was doing, and I said, and this is what I believe we need moving forward, in the boxes, and this would be the position that I would fit best in. And they ended up giving that to me. So I want to encourage you that when it looks like a dead end, an obstacle, look at how you can use that to actually leverage a bump up in your career. Next slide, please. So OB hurt my shoulder and on modified duty, and HR called and said, you have 2 weeks. And 2 weeks for what? And they said to go down to the board, see if you can find another job, not doing patient care because you have lifting restrictions. And I said, do I work in the kitchen, or, and they said, well, you can go home on disability, and I just thought, no, my nursing career is coming to an end. I can't go home on disability. I have so much more to give. And so I went around, marketed myself to different directors saying, hey, can I do quality? Can I do this? Can I do that? And I found case management. I knew nothing about it. And she said, we have somebody who's going to be moving. We haven't posted the job yet. Would you be interested in that? And I'm like, sure. So jumped into case management, loved it, moved my way up to director. And that is where I kept hearing about CDI. And I started CDI within that department. Next slide, please. So I want to celebrate all of you for all of your paths. Know that what seemed bad at the time or wasn't your plan, really leverage that past to take hold of your future. If you have an intentional approach to your career, you can create so much more fulfilling work, passionate work, and you don't have to give up who you are. Continue to follow that path. And right now I'm doing different things. Like when COVID hit, I continued my job, but I thought, I'm a nurse, what can I do? Other nurses are making masks, and I can't make a mask. I barely passed home ec, couldn't get that zipper straight on the robe. So I thought, I'll make a podcast. I'm a parent trying to deal with my 10-year-old daughter, all of a sudden homeschooling and working full-time, and I just thought there's got to be someone that can help us. And I started asking some nurses and teachers and other parents, and found it was a need. So my husband and I got together in mid-August. We launched a podcast to support parents. So the other thing is I did some workshops for nurses on their careers. So don't feel trapped at any time. Providence is full of so many opportunities, and just explore and reach out. There's a burnout committee. I really am passionate about helping nurses in their burnout, so I got on that committee. And next slide. So I just wanted to say Florence Nightingale, she actually was the first CDS. she started recording morbidity statistics, and that helped reform healthcare delivery. Next slide, please. All right, so what is CDI? What do we do? Sometimes they think we're coders, and we both do issue queries. Ours is concurrent, and our particular team is inpatient. There are also outpatients. We call them queries, so they're basically, we send an email according to AHIMA guidelines. And what we're wanting to make sure is when coding gets the chart, that they get that principal diagnosis correct, or that they have all the information to identify that. And so it's after careful study to look at everything that's documented, what happened in the hospital, what brought that patient that they needed inpatient. And so my case management experience really helped me learn how to look at a chart for justifying, why a patient is in. And then secondary diagnosis, what are those other things that are going on that we call the baggage the patient comes in? And that's what we tell doctors. We're like, my patients are sicker. Okay, make sure you get those secondary diagnoses in, and so that we can see that. Next slide, please. And I won't read all of that for you, but I wanted to have it for your resource, that it's not just about the money. I think when CDI started years ago, I started in 2008, it was get the best DRG, so we're reimbursed appropriately. But there's so much more now. We want to find out, was this present on admission? We want to make sure that if the patient has something, that they don't connect that to our service. And if someone passes, that we make sure to capture how sick they were. We gave great care and we document that. So we really try and help quality performance improvement have the most accurate data and documentation available to them. Okay, next slide. So the different roles, CDI, the frontline one is, yes, going through chart after chart and sending those queries, but what they find so fulfilling is they're detectives, and they love figuring out what's going on and making sure that those clues are brought forward. We have educators, we work really well with coding, we have a fabulous relationship with them, and we teach each other, and we have a thriving team of about 40, and so lots of opportunity there. Next slide. So if you're looking to get into CDI, they like to see that you have inpatient experience. All of our caregivers are remote now, which that's super cool. It wasn't just for COVID. We were about 98% remote prior to that, so it was easy to move the last few out. And if you're interested, you can go to Actis and learn more about that and their resources, or certainly you can reach out to me if you want to learn more also. Next slide. Thank you so much. And I just will close with CDI is what some people say is like you're a tax accountant. So we tell the doctors, you don't have to learn all the codes. We're here as your resource. And we actually do help with patient care, because the communication that we have the physicians document concurrently helps that next practitioner know what's going on. And we've seen several times where the incongruence of documentation, we help catch some things that might fall through the cracks. So if you're a detective type person that doesn't like to just check boxes off, CDI might be something to explore in your future. Thank you so much.
So thank you so much. Thank you so much, Holly. Really, thanks for sharing the uniqueness that nurses can find in their journey and encouraging us to really find our niche. It could be something we find first out of the gate and spend our whole career, or we have opportunities to journey as you did and find a passion that you can continue in your career. And again, pointing out that because Providence St. Joseph Health is so vast, we really have those opportunities across our organization, and really encourage people to stretch their wings and find the right career and right passion for them. Really to be open to where your career can take you. It can sometimes be scary, as you said, but trusting that your nursing career is a great foundation and will give you something to truly build on. This is a great segue to our final segment of our time today, celebrating the diversity of careers in nursing. And Rachel Manchester will share with us the fun journey map and some practical steps to embrace if and when you find yourself pursuing a new niche in nursing. Welcome, Rachel.
Thanks, Michelle. Boy, I've been so honored to hear our last speakers. Holly taught us that we can land on our feet even after injury. Kristen sharing Lexi and Sarah's diverse backgrounds and how they got into where they got. And of course, the fun Lisa and her bugs. I can't get enough of her. She's awesome. We wanted to provide you today with a journey map, recognizing that, you might be in that moment of your journey where you're considering something new. So we've tried to identify some steps here that are kind of the major buckets, but we recognize that every single person's journey is individual. We've just heard 3 speakers share that with us, right? So starting on the far left, we're going to talk about some of these bullets along the journey that if you are looking and you're a planner, maybe you are, like Holly said, maybe you didn't have a plan and all of a sudden you find yourself needing another job. These might even help you decide, well, what do I need to do to get there? So caring for yourself is very important. And we recognize that that first opportunity in your journey may come from a moment of discord, right? Check in with yourself. Make sure that you're fully prepared and fulfilled in your career. Like Holly had mentioned, she's here to ignite the passion. And if you have burnt out in your current thing, we are so lucky to be nurses at Providence St. Joseph Health. We have a smorgasbord of opportunities for you. So after you checked in with yourself and you've answered that hard question, which honestly can be the hardest part of this journey, just what do you want to do with your one wild and crazy life? After you decide what that next adventure might be, you need to find a good mentor. This might be somebody doing the work or somebody that knows someone that can answer your questions. Lisa mentioned the way we got her was from a friend reaching out to her to tell her about the opportunity that it presented here at Providence. How lucky are we that her mentor told her about these opportunities. So chat up your opportunities if you have open spots with your colleagues. Then you need to find out, what do I need for the skills of that role? Perhaps it's more education. We have our very own University of Providence. How many employers can say that? Just wanted to know. There are wonderful degrees that are both undergraduate and graduate degrees. And even though not all journeys may require formal schooling, maybe you have an opportunity with some time on your hands to just take some extra courses and continue your learning journey. Next, our mission is so vital to the work that we do to provide care for our poor and vulnerable patients. Asking your supervisor to attend leadership formation is a great way to really learn about our Providence history and also to peer network. Those connections that we make in leadership formation last our nursing lifetime. And it's not just nurses that we might meet in those formation. We get to understand how the entire organization fits together to serve the needs. Like Holly said, she's playing with records and being detectives, and that's still impacting direct patient care and our overall budget. How lucky are they? Social media can't be overlooked. That is the way we're doing business these days. So connect with those that are in your desired settings. As with any major decision, it's important that you're visualizing yourself in your role. Seek out volunteer opportunities. Our mission work is a great way to get hands-on experience. Volunteers in Partnership is just one of the Providence offered mission opportunities, but there's Medical Teams International, there's many things. Our own Michelle Janes leads several teams across borders to help communities in other settings. That might be your newfound joy. The other cool thing about volunteering, I don't want to forget, it might help you get a leg up on that other applicant that's vying for that same position because you have hands-on experience. So consider community-based roles as a caregiver and a contributor. Many times there are public forums, blogs, or boards that you can join. And as you're learning more about your new desire, don't forget to look at the national scene and join in on the discussion. Really figure out, like Anne presented at the very beginning of our reflection, how are you perceived? What's happening in our worlds? Once you have some experience and some more in-depth knowledge, update that resume. LinkedIn and Indeed profiles are where it's at. That's how people shop you. Many times it's your relationships with others and helps us have the courage to take the step because we know someone. I mentioned before, but I'll say it again. Lisa's here and we are lucky to have her because somebody had the courage to tell her about the job, and here she is. It's not sometimes what you know, but who you know that gets you that position. And then the next step is make sure you've got your manager in your loop. Share your personal goals with your success factors planning. We're here to help each other at Providence St. Joseph Health. We want you to stay with us, and we want to make sure that you're continued to be fulfilled and giving back to our communities. PSJH has automated job postings that you can have pushed to your internal email. You just put the settings in your criteria and they do all the hard work. As a care continuum leader, I always want to mention, don't forget about other settings. The non-brick and mortar, like Holly's setting, she's out in the community, our care managers who are, at the front lines and really navigating the patient's next step. And then for those of us in the care continuum who catch you when you fall out of the acute setting, we're here for you all along the way. We are all the places of nursing. And then that final step, take the plunge, apply for that job. Internal applicants here at Providence get a leg up, so use that against your competition. We know that you are mission driven and patient focused when you're here, and we definitely want to foster that with you in your next journey. Next slide, please. To continue our series, we have the blessings to have Dr. Troy Larkin, Dr. Melissa Robinson, and Maracy Wilson offering our next session to tell you more about our opportunities at the University of Providence. From 9 to 10 a.m. on August 26th, we hope that you'll join us to learn more. Here's a link at the bottom to our SharePoint site for our entire P&I seminar series. We hope that you enjoyed today's lecture and learning about all the places of nursing. And I'll turn it back over to Michelle. Thank you.
Thanks so much, Rachel. Thanks so much for all those key points that you shared with us for how to navigate that journey. Should we be looking for something else? And sometimes it's not even a new career. Sometimes it's just something to leverage what we've already learned. I think I would be remiss as the Chief Nursing Informatics Officer if I didn't speak just briefly before closing today on a nursing informaticist role. It is definitely a much needed role that we see more and more as electronic records become our life. Really, clinical informaticists, I'm so very proud of them and my team. We really are those translators between clinical practice and technology. We really focus also on training, being able to help people learn how to really personalize their EHR experience and how to get that documentation that Holly needs then afterwards. We have workflow expertise, so we can help to hopefully streamline and help the clinicians get to the information they need in a quick and efficient manner. And really the most important thing that we continue to focus on is how can we decrease the burden of documentation. We know that healthcare now is now the most highly regulated industry, ahead of nuclear power plants, if you can imagine that. And so that amount of regulatory requirement for documentation just continues to grow exponentially every single year. And our clinical informaticists really work very hard to try to continually see what we can do to reduce that burden of documentation while making sure that we have the information we need to take care of our patients every single day at the fingertips of those who need it. So I want to thank you for joining us today. I want to thank all of our speakers. We started with a great reflection that really challenged us to live our one wild and precious life. We were then treated to 3 great presentations from different facets of nursing. Thank you for sharing your passion and your interest in nursing and your key learnings that you've learned along your journey. Lisa shared her childhood and life experience and how that led her to be an infection prevention nurse. And I'm sure many of you share in that as well, that your life journey started from a very young age and worked to form you. And hopefully that formation has continued both in mission as well here at Providence. Kristen shared insights from her colleagues on the unique role of a proactive outreach team nurse. What a very diverse role that is, really getting an opportunity to meet our patients where they live. And that has such an impact on taking care of the poor and the vulnerable. And lastly, Holly spoke about sometimes life has a way of asking you to explore new adventures, and that gives you opportunities to further your career and advance you into areas you may not have thought would be your career or your life passion. But it can be, and it can obviously end up being a very critical and a very lucrative career for you as you continue to go through that. So we want to thank you today for joining us in today's nursing seminar series. Please don't forget to visit the SharePoint site where this presentation will be posted. You'll be able to get full access to all the slides, including the journey map as well. And you'll also be able to register for the other remaining presentations that will be going on for the rest of this year. We're very excited to be the first, and thank you again for joining us, and hopefully you will continue to enjoy your nursing career here at Providence St. Joseph Health.